Good morning, folks. DJ here again. Welcome back to the channel. If you're not a subscriber, don't neglect it. Do subscribe to the channel. It doesn't cost you a penny, not even a cent. It doesn't even cost you a rupee. It's totally free to subscribe to the channel, and it brings you back here if you wish to come back, of course. And I love to read your comments, and I also like to see that you like the posts. So that finished. I want to talk to you today about, and it's this morning, it's Saturday morning, and it's 9:45, 9:47 to be exact, and I'm talking about developing positive oral health habits that benefit your whole body, your entire body. It's Dr. let me get the name right, Catherine Tannehill. She's a dentist at Portman Dentics, and she explains that there is so much more to oral health than pearly whites. Our teeth act as a gateway to the body, she said, so ensuring you have a good oral hygiene means you avoid more serious health conditions. Failing to keep your mouth healthy has some serious repercussions. It's thought half the adult population in Britain has gum disease. Half, 50%. The first sign is often bleeding gums, known as gingivitis. And the studies have shown that those with gum disease may be more likely to suffer a stroke, says Nairi Whitley, Chief Clinical Officer at My Dentist. Not My Dentist, that's the name of the company, My Dentist. Experts have made the link between not enough toothbrushing and heart disease. She warns, research has shown people who have poor oral health or suffer from conditions such as gum disease or tooth loss are at an increased risk of developing cardiovascular issues. Bacteria that aren't effectively cleaned from your teeth, gums and tongue can make their way around your body into the bloodstream. I'm going to read something now that I wrote down here for myself, and now I've forgotten it. In 2023, a study by Aberdeen Royal Infirmary found that 2/3 of the 160 people admitted with heart attacks had severe gum infection. 2/3, 66% of the people brought in because they've had a heart attack had gum infections. In rare cases, the inflammation from bacteria within your mouth can also lead to an infection within the lining of the heart, which over time can cause clogged arteries. This is dangerous stuff for the sake of your teeth. Dementia. Academics have been working to establish a link between dental problems and dementia for some time. Professor Nicola West, who led the MySmile study at the Bristol Dental School, explains recent studies suggest a clear association between dementia and poor oral health. Best brush your teeth. A study has shown oral bacteria were 4 times more likely to be found in Alzheimer's brain than a brain without the disease. 4 times. Other studies have shown that periodontitis, perhaps I need new teeth, these are mine by the way, is associated with a 6-fold increase in the rate of cognitive decline. Professor West has some positive news. Oh, that's good. However, evidence indicates that if gum disease can be stabilised, it might be possible to slow dementia disease's progression. Slow it down. Because bleeding gums is a predictor of developing periodontitis, early detection and management is thought to prevent many cases of periodontitis before the effects become irreversible. Being vigilant about your gum health and that of any of your older relatives is important, she said. As Professor West says, The key message is to brush your teeth twice a day with a fluoridated toothpaste and see an oral health professional regularly. Well, do we want to do that? Now, men, gentlemen, erectile dysfunction. Yes, I've gone there. This erectile dysfunction. Your sex life and toothbrushing might seem unrelated. Beyond preventing your breath being off-putting. Yeah. But a study at Jian University in China found that poor oral health can more than double a man's risk of erectile dysfunction. So if you're not brushing your teeth, it seems not only does your breath put your wife off, but it also puts you off. Double whammy there, double whammy. Dr. Victoria Sampson, a functional dentist at the Health Society in London's Mayfair, says the link between erectile dysfunction and periodontal disease is real and strong. Men, get out there, brush your teeth now, quick. Poor oral health, particularly gum disease, can cause the release of a low-grade chronic inflammation from the mouth to the rest of the body. This inflammation can damage blood vessels, restricting blood flow to parts of the body, including the penis. That's what Dr. Victoria Sampson said. And she should know. Fertility and birth weight. So, ladies, listen. Last year, researchers in China found that maternal periodontitis was linked to babies with lower birth weight. Pregnant women and women who have had a baby or a stillbirth in the last 12 months are entitled to free dental care, as pregnancy hormones can exacerbate inflammation of the gums, leading to possible infections or gum disease. The National Health Service advises pregnant women to apply for a maternity exemption certificate, known as MATEX, to secure free dental appointments. You'll be able to get one from your midwife or doctor. So ladies, take note. Your babies could be born stillborn, dead at birth, or they're underweight. So brush your teeth. And men, if you want your wife to have a baby, brush your teeth. Academics have also begun examining a link between gum disease issues and infertility. The findings aren't yet well defined, but it's thought that the chances of a pregnancy will be lower for women with gum disease. Experts in Sweden believe the condition can cause women to take 2 months longer to conceive. That's from Sweden. I don't think I would want to make love to a woman who had gum disease and didn't brush her teeth, but still. Lung disease, yes. People could also find themselves more at risk of developing lung disease due to having a higher level of bacteria within their mouths, which can cause chest infections, warns Nairi. I'd recommend brushing your teeth twice a day and flossing regularly. Diabetes. So we've got heart disease, we've got penile problems, we've got pregnancy problems, birth problems, we've got arteries problems, lung disease, and now we've got diabetes. Good dental health is key for minimizing your diabetes, or the risk of diabetes, Dr. Sampson explains. The connection operates in both directions, with diabetes increasing the risk of oral health issues and poor dental hygiene exacerbating diabetes. So research has shown that if you have gum disease, you are 53% more likely to develop diabetes. And if you have diabetes, you are 34% more likely to develop gum disease. Two-way street. It's important to note that controlled diabetes is not a risk factor for gum disease. However, if it is not well controlled, patients can develop a more severe form of gum disease, which is harder to treat. Severe gum disease can impact blood glucose control, and there's a direct link between how severe your gum disease is and your risk of diabetic complications. Now, the government gets involved here. The Office for National Statistics say that 96%, so nearly 100%, of those without a dentist and who tried to access the National Health Service dental care were unsuccessful. 96% of those who tried to access the National Health Service, the NHS, dental care were unsuccessful. What is going on there? My dentist, Noreen Whitley, says it can be challenging to get an NHS appointment because of the national workforce shortage. If you spot any signs and symptoms that are out of the ordinary, try to arrange a checkup. The NHS Choices will tell you which practices are taking new NHS patients locally, and you can visit the nhs.uk/service search/find a dentist. I'll repeat that. The NHS is difficult. 96% don't get an appointment. If you try, and the choice is you can visit on the internet NHS, that's in common letters, /service/search/find-a-dentist. I'll put it in the write-up in descriptions so that you can read it. But it's very important, isn't it? We've got from not cleaning your teeth properly twice a day, clean them up. I use a very specialised toothpaste. I'll show it you in another video. I use an ultrasonic toothbrush. I have a cleaning on the wall. It's electronic and it cleans the toothbrush heads, very clean. And I use a mouthwash, which it helps the teeth as well. So, and it does a thrusting into your mouth. I don't swallow it. No, it's automatic. I'll show you that as well if you like. I'll do a video on dental or hygiene. How about that? So what I'm going to do, I'm going to leave it to you now. Don't forget to subscribe. As I say, it doesn't cost you anything to subscribe. It does help me. And if you like these, press the like button and make your comments known. And until the next time, and I will be doing another one today. So until the next one, I'm going to say bye for now and be safe, be good, and goodbye from DJ.